All right, you guys ready to get going? Let's
Let's
do
do
it.
it. Let's do
Let's do
it.
it. All
Let's
right.
do it.
So, welcome everybody. So good to have you. I'm very excited. I'm Dr. Laurie McCauley from Optimum Pet Vitality, and today I have a very special guest. I have a dear friend, I almost said doctor, right? Almost.
Oh, not a doctor.
Kasey Braun, who is a friend and licensed veterinary technician since 2002, certified canine rehabilitation practitioner since 2006, board certified animal massage therapist since 2012. Kasey and I met in the osteopathy course, and I'm so excited because she's one of the people I know that has actually been using a tuning fork for a long time. And it's like, oh, yay, you get it. It's so wonderful. We can connect and teach and do all kinds of really cool things.
Yes. We
Um,
share our love for the tuning fork.
yes, yes. Continue to learn and grow.
Yes.
Kasey has dedicated her career to helping animals move, heal, and thrive. And her expertise in myofascial therapy, lymphatic work, rehab techniques, and other specialties has allowed her to support countless animals in achieving better mobility, comfort, and overall well-being. She works with veterinarians and other professionals to teach in-depth understanding of anatomy, biomechanics, and therapeutic touch, ensuring individualized care for every patient she works with. She's committed to education and mentorship, teaching pet parents and professionals the benefits of canine bodywork and massage therapy techniques through workshops, training programs, and one-on-one coaching. She is the founder of Stillpoint Animal Wellness, and she continues to innovate and advocate for a whole body approach to healing, ensuring that every pet receives the care, movement, and balance they deserve. All right, Kasey, I'm so glad to have you here with me.
Thank you so much, Lori. Thank you for having me.
I have a bunch of questions to ask you. So let's start with something like the very, very basics. Kasey, what's massage?
Yes. Well, that's a good question. So massage is a series and a whole beautiful harmony of techniques that you can use to aid in the body in healing and recovery, to comfort pets by using different techniques. There's lymphatic techniques that help with swelling and to rid the body of metabolic waste and toxins, as well as fascial release techniques. It's a whole just variety of different therapies that is manual work towards the body that helps it reset it and aids in the healing process. That is what
Oh,
massage is as a whole.
yeah. So can
Mhm.
you so that's what massage is from the therapist standpoint, what they're
Yes.
doing. Can you tell me what actually happens inside the body during a massage?
Yeah. So actually, the cool thing about massage, the most I find the most fascinating is actually one of the only therapies we use a lot of modalities in rehabilitation and in body work that can kind of target certain areas where massage actually targets all the systems in the body from the level of the integumentary system where we're kind of looking at the body in layers, right? So from the skin to the fascia to the muscles to the bone to the digestive system to the nervous system, all of these things that we're actually able to engage when we're using just as simple as our hands and in these therapies. And it's just the way that we're able to manipulate the tissues in certain ways that we can help these patients that have maybe come into their, into a surgery or have had an injury, as well as just aging, or maybe even their puppies that are growing and they have a intent, for big things in their lives like sports and things that we can intervene and or even just be there to support the body in all those different systems. And that's what I think is so cool is that it's really just like the one time that you can affect all the different systems in the body and you're doing that with your hands. And I think that that's what's so special about it. And when I'm speaking with pet parents and explaining to them during a session, they're asking me like, what are you doing? And I'm like, well, this is what I'm doing to the lymphatic system. So what this means for you is that I am working on helping the body drain the swelling and aid in expediting that healing through this type of technique. And I think that's just one thing that is so fascinating about how the body responds to massage, but also what it can all do.
Yeah, absolutely. So keeping on the lymphatic system, can
Yeah.
you explain how massage affects the lymphatic system?
Yeah, so with the most gentle touch, and usually it's between 2 to 4 ounces of pressure to stimulate just under the skin, the superficial fascial or superficial vessels of the lymphatic system. We're able to kind of mimic that movement that happens in the body. So the lymphatic system doesn't have a pumping mechanism like the heart does, right? So the heart pumps the blood and the circulation happens where lymphatic actually the lymph flows through those tissues through muscle and activity of the fascia and everything else, right? So it needs that little it needs us to move, right? So that's why movement is so important. It's we say motion is lotion, right? So it helps to lubricate the body and keep things going. And when we're doing lymphatic massage, we are actually like helping that mimicking happening to be able to get that metabolic waste to flush through the system, past the lymph nodes, back up to where it can dump back into the circulatory system and be processed through the body. So it's a really cool way of boosting the immune system because the lymphatic system is your main portion of your immune system, right? And so if we're doing lymphatic work, we're helping flushing out all that waste in there and all the gunk and junk, and we're able to clear the body so that it can heal faster and easier, not having all of that inflammation in and around the joints and everything. So that's what lymphatics does to the body for a lymphatic massage.
Cool. So
Yeah.
let's keep going with that. Can
Yeah.
you explain how fascia and the lymphatic system work together?
Oh, this is my favorite. So we think of fascia as one connective web, right? And you and I share a deep, deep love for fascia
Uh-huh. Yeah.
um, together. And so um, fascia is like this connective web that attaches everything and every structure in our body, right? Well, if we have an injury, say we have a hip dysplasia or we have a TPLO, which is a knee surgery that is very common for pets, and so if we have an injury, our fascia wants to protect things and it wants to lock down. And so what happens is that we get this innate, like instant response from our fascia that says, "Nope, I have to hold this tight and I have to protect." And so that protection um, also compresses down on the lymphatic system. And that's where we get like pockets of fluid buildup. That's where the inflammation just can't move through and things get really congested. And so the combination of doing, which is where I love my tuning forks too, is that you open up the fascia and then you're indirectly and directly with your manual therapies, opening up the lymphatic vessels as well. So you can get things to flush through. And so you drain the body of all of that extra inflammation. And that is the kind of the beauty of they work very, symbolically together. They just have this beautiful relationship of like, okay, well, if I loosen the fascia, my lymph goes better. Well, if my lymph is flowing through the body, then I feel better,
Yeah.
right? And so that's the gist of having it. You have to have to work both systems, right? There are two major systems in the body where we can't just say, well, I'm only going to work the lymphatic system because you're also working the lymphatic or working the fascia and vice versa. Right. And so those two systems have to work harmoniously together because if one is locked down, you're not freeing up the rest of it anyway. So you have backup and congestion and all sorts of different problems.
Yeah, and that leads to all kinds of health issues.
Yes, yeah, a lot of compensation, a lot of stagnation in the body. We have buildup of fluid and inflammation, as well as the restrictions that happen when the fascia is locked down as a whole. So,
Yep.
yep,
Yep.
absolutely.
So getting rid of pain and stiffness by getting rid
Yes.
of that inflammation and what I call
Yep.
the icky, sticky stuff. I love how you
Icky
have that
sticky.
like that great, cytokines and metabolic toxins and all of metabolic waste and toxins and all of that stuff. And
Yeah.
I just group it
Yeah.
in sticky icky.
The sticky icky. I love it. The sticky icky. Yep. That's
Yeah,
exactly what it is. And we're moving it and making that slide and glide.
that's right. Just like a slip and slide.
Yep.
All
Yep.
right.
Absolutely.
So let's go on a slightly different track. Can you
Sure.
explain what Stillpoint is?
The business or the name?
The
Are you
name.
asking? The name, yes. So Stillpoint is where the body actually is put into a safe space where it can pause for just a second and reset and rebalance. It's like the body's natural reset button. And when you create a still point by maybe doing certain types of body work or breath work, it helps the nervous system calm down. So we like to levitate in the fight or flight symptom, right? So we need to be put into a parasympathetic, which is your relaxation, your rest and digest, and your feel good, your yummy area, right? If what happens is a still point create is the still point is where the body is shifting into that pause. And in that pause, when it relaxes enough, we shift towards healing. And it's that shift, that still point, where we shift into better healing and balance.
Nice.
And that's what it was. It felt so strong to me when I was thinking about my business and what what really is like so meaningful about it. And it was just really that moment of like everything comes to a pause. And then going forward, we know that it's getting better from there.
Yeah, it's where the healing begins, right?
Yeah.
So can you let people know why you developed Stillpoint Animal Wellness? So this is not just
Yeah.
words, but the actual place.
The whole thing.
The
Yeah,
whole
absolutely. Um, I have been in veterinary medicine for a very long time. I've worked in rehabilitation for a very long time. I found my passion for body work um, in the midst of my career, and I I just know that people want to be a very intricate part of their pet's healing and their pet's recovery. So taking that to where I can go into their home and I can talk with them and I can do the therapy right there in the comfort of their home, as well as educate them. So it's not just, I'm going to come in and do body work for you and then leave. It's, I'm going to come in and now I'm going to teach you what you can do in the interim of your veterinary visits. It's not a substitute for veterinary care. It's let me show you how you can help and be part of this recovery process by doing certain type of therapeutic massage or doing some lymphatic work or doing some fascia or doing tuning forks or whatever the case might be, that they feel like they're part of it. It
Mhm.
breaks my heart when I hear people that have lost their pets and they're like, I wish I would have known more that I could have done for my pet.
Right.
When during that very precious time, or maybe it was I didn't know what to do. I got sent home from the surgery and I had no idea what to do.
Mhm.
And I don't think it needs to be that way. And I felt very, very passionate about that. And so Stillpoint is a blend of an educational place for pet parents and for pet professionals, um, with classes, and everything else, but also, and they're in-person classes because I like to teach. That's the way I like to teach is in person. But also just being able to go in people's houses and saying, hey, your animal is more comfortable here if I come to you. And also, hey, let me teach you a few little tricks. And this is what we can learn of how to make it easier for you to even if it's not therapeutic massage, it's like, let me show you how to gently escort your dog out using this harness that was recommended to you, and I can help you. This is where the pressure points are, that when you take that harness off, you should do this type of massage here because it's going to ease that pain and discomfort of your pet. And that's, I think, the biggest thing is just being able to bridge that gap of like, I don't know what to do and I'm in a panic of like, hey, wait a second, I can help you with that.
Right.
So,
Yeah. That's my heart too, right?
yeah,
The motto is empowering people, optimizing pets. How do
yeah.
I lovingly tell my clients, I love you and I'm going
And
to treat you as much as I can, so I don't have to see you as much, not because I don't want to see you, but so that I have enough time to treat somebody else.
right, right. And same. And that's exactly how that's what I say to mine as well. And I'm like, I'm not trying to put myself out of a job here, but
Right.
the more you need me, the better you are doing for your own pet, which I think
Right.
is fantastic.
Yeah, I
Mhm.
always look at it as I'm just part of the team. How can I
Right.
best help you as part of the team?
Yep. How can I
Cool.
best help you? Yeah, absolutely. And I think that's so important because if they're feeling empowered,
Mhm.
the pet is feeling like they feel that and they get that. And the connection that happens between an empowered pet parent of like, hey, I feel like I'm doing something, and I sit down at nighttime and I'm doing some massage and I'm putting a little heat on their hips and I'm making them feel good. It takes that like bit of I'm afraid of what's next away, and not completely, but it just eases that nervousness that they have because they feel like they're part of this,
Yeah,
and not feeling like they're just a chauffeur to bring them to vet visit. It's and a very important part of it.
yeah.
And I
Oh,
think that that's
absolutely.
really cool that we can help with that piece of it.
Well, and I think too, it when we teach them things to do and they do it with their pet, then it
Yeah.
enhances the human animal bond, which I think
Hmm.
is a really important part of it as
Yeah.
well.
Yeah, absolutely. It's very important. And as a whole of what I see, I worked in clinics and different rehabilitation centers and all these different things. It's like when an animal comes in, there's already this level of like, oh,
Yeah.
anxiety and just everything. And to take them, the work that I want to do that is so in depth that I'm like, we're gonna, if I really want to push them and nudge them towards that still point, which I
Mhm.
dearly believe in, I need them to feel like they're in a safe space. And so I want to see them at home and I want to see them in their natural environment, and even getting information from pet parents. And this, like watching the video or watching them in their own environment versus like walking down a hallway in a clinic is
Right.
completely different information, right? And
Yep.
so if I can see them in their natural environment and I can see what's happening. And also, like, you know, going into people's homes, you kind of have a better idea of what's going on. Like, how do they have to navigate this situation, and being able to help them with that. And I think that's cool,
Yeah.
it's having your own, like, person to just come in and be like, okay, we're going to do a little furniture arranging in here and we got to move things around,
Mhm.
you know?
Yeah, yeah,
So
yeah.
it's just it's fun.
Yep, yep. I'm laughing because one of my favorite ever keynote speakers
Mhm.
was a female basketball coach. And she said, most people walk into a hotel room because she's got her team, right? College
Right.
basketball girls, and they see a bed and a chair. I walk in and I see, if we move the refrigerator here, we can do this exercise here. And if we do the
Yes.
bed this way, we can do this, right? I
A
think
hundred
that's
percent.
when we go into people's homes is we're like, okay, what can we change to make it
Hmm.
so you could do this and this and this and this?
Yeah, absolutely. And it's game changer for them because they're like, oh, I never thought about that. I'm like, well, we could do this, or, I am always MacGyvering everything. That ages me,
Mhm.
I'm sure. But, I'm like
Right.
always crafting something. I'm like, well, we could make this for you, or, I can build this for you. And, let me go back to my shed and see what I can find. And we're going to make this ramp that's going to work this way. And this is how you're going to assist them. And they're like, oh, okay, this is great. And so
Oh,
it's
yeah.
helpful just to be, I think it just is so special that people can invite you into that part of their world because it's so sacred. I mean, their relationship with their pets is just such a huge part of people's lives, and to be part of that, I think is just so special. So I like that piece of it. And you don't get that when you're in a hourly clinic kind of setting, and you never know. Like, you can do a lymphatic work and be like, okay, I have 15 minutes, and the dog's like, I'm panting and I can't get settled down. And you're just not, you're not achieving what you can when you're in a more natural setting. So
Right.
yeah.
And we have to do the best we can with what we have.
We do absolutely, because that's the scenario, and so we just try to make it work.
Yep.
Yeah.
Yep. Cool.
Every time you see a pet, you have to think about, like, what can I do? How can I work around this situation today?
Yeah.
You know,
Yeah.
and it's constantly thinking, thinking on your feet, and changing and being adaptable to all the different situations. So yeah,
Yep. Very cool. Good.
fun.
All right. So I want to go back to, we talked about massage and you mentioned body work. So
Yeah.
for everybody listening, can you tell the difference, what the differences between massage and body work?
Sure. Yeah. So body work more kind of encompasses like everything. So other tools that you apply to the body, maybe like tuning forks, for example, right? So massage is hands-on, right? It's a hands-on therapy. You're manipulating tissue by what you're feeling, what you're palpating, what your assessment is, and every time that you're, working different layers, right?
Mhm.
Bodywork kind of encompasses all the different things that all the different techniques and everything kind of that's in your toolbox, that you would use to work on the body, is the best way to explain what bodywork is, right? And
Mhm.
so a variety of tools in the toolbox versus therapeutic massage, where I am working directly with my hands and my hands only on the body. So that's the difference of that. And so I often will use the term bodyworks, and I get the, bodywork, because I do get this question a lot. They're like, well, what does that mean? I'm like, well, if I would have just said massage, and then I'm like, hey, here's my tuning forks. And they're like, but wait a second, you didn't say anything about this. So bodywork kind of just gives me a link. It's a all things encompassed.
No, I agree. I agree. To me, body work also includes like my manual work, right? If I'm doing joint
Yeah,
mobilizations and
right.
stretching and all
Yes.
of that stuff.
Yes. Yeah. It's all of your manual, and anything of that is affecting the body
Mhm.
with whatever tools that you are using, whether it be your hands or something external. Versus massage is a little different. So
The body work is the umbrella.
yeah.
So tell me what your most, I was gonna say most favorite, your favorite body work techniques are and why they're so important.
So, my favorite bodywork techniques, manually, probably fascial unwinding. I think that's probably one of my most favorite. And diaphragmatic work. I think the diaphragm is such an underrated and forgotten area of the body, and working the ribs and working the diaphragm. And it just inadvertently opens up everything, because when you work the diaphragm alone, um, we think about like how every time that we go into a studio, they're like, breath work, open
Right.
yourself up, right?
Yep.
If you're constantly holding your breath, if you're feeling this tension in your body because you can't breathe, because you can't get a good deep breath, it throws everything off. And when you can do diaphragmatic release by gently assisting that diaphragm to not be shoved up underneath those ribs, and
Hmm.
opening up the ribs so they can expand and you can breathe and the scapulas can glide and all that good stuff, you are shifting that nervous system to go, oh, I can take a breath. I feel so much better. And everything else kind of goes along with it, because it's like, for dogs, it's the trunk, it's the suspension bridge of the body, right? And
Right.
it's all held very, very tight, right? So when we do diaphragmatic work, we're opening up all of that so it can move so much freer. And then the the paraspinals and all of the abdominal muscles and everything else, the hips and the shoulders, everything is just like, okay, I get it.
Right.
We have a little bit more movement here and a little bit more freedom to move how we should as well. And so that's probably one of my favorites.
Hmm.
Um, and of course, tuning forks. I love tuning forks. Tuning forks are so cool because as for the years that before I knew tuning forks, it was like massage as a whole, right? There's only so many layers that you can get to. You can get in pretty deep, but you feel like sometimes, and I was like, man, I wish I could get to that medial side of that scapula.
Hmm.
And now I'm like, I can take my fancy little tuning forks and I can angle this just right. And there I go. And all of a sudden, boom, that scapula starts to glide. And how cool is that? Like we go from it's just one extra layer of being able to get deeper than we were able to before. So I just find it so fascinating because it just gives us as body workers one more thing that we can do. So
Oh,
yeah, those are
excellent.
probably my two faves.
Okay. Yeah, I mean, absolutely. My favorite, again, is manual therapy, doing my joint mobilizations, and the tuning fork has just been an eye opener of, getting rid
Yeah.
of scar tissue and opening up the diaphragm and the
Yes.
lymphatics, and we're playing with, using the different stones to help with like
Mhm.
nerves and kidneys and liver and
Yeah.
eye stuff, and
Yeah, working the
it's just
meridians and
cool.
all of that. Yeah,
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 stimulating the acupuncture
yeah,
points, all of that. Yeah.
yes, yeah. And even for acupuncturists, we use it in tandem um, with dropping, the acupuncturist that I work with, it's like she needs to put a needle in and it's a tender spot. And I'm like, let me do tuning forks there for you. And the needle slides beautifully in for her. And it's just, how cool is that? You can make it just so much smoother and so much more comfortable. So the tuning forks is fascinating. I think it's really I'm learning more and more. And every time I learn more, I just get like giddy about it. I get super excited.
Yeah,
So,
yeah, yeah, me too. I mean, I think it's
yeah,
definitely an emerging field that we're like on the forefront of. That's just so
right. Yeah.
fun.
Yeah. Yeah. It's fun and it gives us like I said, it just gives us one more thing that we can go, I can't reach here,
Hmm.
but now I can,
Yeah.
and that's just really cool. So,
So I have some questions that I hear commonly from pet parents. Can I run
yeah,
through them with you?
sure, sure.
All right. So my pet had rehab. Why do they still seem painful?
Likely because the fascia was not addressed. That's one of the biggest reasons. The thing about it is that if you go from surgery straight to rehabilitation without having any body work or mobilization or anything of that sort done, um, the muscle fibers are still holding on tight,
Mm.
right? They felt that injury right from the get-go, and fascia responds so quickly in the body. And they went through surgery, and the body is holding on to that trauma, right? And if you go right from that to strengthening, you've bypassed loosening up those muscle fibers. So those trigger points are holding tight. And the problem is that if I flex my biceps, I can only flex it so far to make it tight. That's as far as I can get that contraction. And that's like, if you think about that with a trigger point is like, I can get it to be this tight and that's or it is this tight. If try to add strength to that or try to build that strength,
Mm-hmm.
it can't get any stronger because it's already as contracted as it's going to be. And so if you don't unwind those fascial restrictions or those trigger points, you're not going to build strength. You're just going to make things more painful because the body has to adapt to that area where it's stuck and it's uncomfortable. Um, and that's why you kind of have to have, you have to have the blend of both the body work and the rehabilitation. The strengthening is such a huge piece of it, but it's not going to get better unless you address those fascial restrictions or those myofascial trigger points.
Yeah, nope. I agree. I
Yeah.
agree. All right.
So,
Next one I have is I do multiple modalities with my pet, laser, exercise, PEMF. Why do I need massage?
Because you're not hitting all the layers. You're not hitting all the systems. Everything is intertwined. And, laser works great. It works wonderful for pain and inflammation. You have, ultrasound, you have shockwave, you have the rehab pieces. There's so many different modalities out there. But again, what your hands can do the with massage is greater than it combines all of those things, and it basically adds in the ability to allow those modalities to work better, basically. And so if I open things up, my laser therapy is going to work better. All my stretching, all my rehab exercises, everything are just going to improve because I've loosened up that tissue and I've basically prepared it for those modalities. And so it's not one or the other. It's that power of the and. It's the in between. It's
Right, right.
everything. Yeah.
Absolutely. All right. Next one is, and I saw that we have a question. So I'm going to
Sure.
go through my last two questions
Hmm.
for you, and then we can get questions from everyone listening.
Okay.
My dog had a cruciate injury. Can massage help him?
Absolutely. Absolutely. So, going back, I kind of touched on this before, is cruciate. So with a cruciate, as soon as the injury happens, the fascia locks down, inflammation begins, right? So we have swelling, and then under that swelling or the swelling is there, and then over top of that swelling, I should say, is the fascia that's like, oh wait, hey, I need to stabilize this, and it locks everything down. And then that compensatory pattern and all the things have to adapt, right? Because fascia is a whole body network. And so it has to adjust for that area being tight or being protected more so. And that protection kind of starts a downward spiral. So as we're working through not only the trauma of the surgery itself, trying to reduce down inflammation, reducing down pain, we're trying to aid in the mobility of the joint itself, trying to get it back, that range of motion back. Um, Massage aids in range of motion. It helps to loosen the fascia so we can move better. It helps to drain that area because of the lymphatic work that we're doing. And it allows us to kind of progress in a nice, smooth fashion. Um, Without it, it slows the process down. And
Mhm,
so when we're not doing therapeutic massage, not that you can't recover without it, because you do what you can do,
mhm.
but with it, it just allows the body to reset and rebalance a lot faster.
Perfect. Awesome. So what can people do at home for their pet? Can you talk a little bit about start with passive touch?
Yeah, yeah. So I love passive touch because it's really just simple. It's literally just placing your hands on the body in an area where there's maybe some tension or discomfort in just a very comforting way. We can we can generate heat in our own hands, or we can pull heat from a body by placing our hands on the body. And passive touch is something that is not, there's no pressure to it other than just the weight of your hands directly on the body. And it's no movement involved. So everybody can just hold it. And I always say to my students, when something hurts, it likes to be held.
Hmm.
This is our first natural, innate thing that we do when we are in pain, is that we want to hold something. We want to hold it. I hit my shoulder and our hand just instantly wants to hold it. And that is passive touch. But for the animal that you're working on, or for your pet that you're working on, right? And so we're doing that for them. And in that moment, it is releasing tension just by having our hands placed in an area where there is tension. It's releasing that and allowing that fascia to go, ooh, I feel safe. I can let go a little bit. And when I can let go, then I'm like, oh, all the rest of the systems start working too. So that's what passive touch is.
So this is
So it's
passive touch.
very, so it's very, I'm laying, it's laying the hands on the body is basically what it is. And so it's just a very like, if I take my hand and I contour, the important part about passive touch is that we don't want a rigid hand. We don't pick up information when our hand is stiff, right? So when we do passive touch, we contour to the structure that we're on.
Mhm.
And it's just the weight of your hand again. And you're basically placing it over the area and contouring over the structure and allowing it to sit. And that's it. That is passive touch. And sometimes it's 10 seconds, sometimes it's 30 seconds, depending on what the dog wants. And then you can move on to a different technique.
Excellent. Now take it one step further from
Yeah.
there to compression.
Yeah. So compression is very similar. If you look, it looks very similar to passive touch because, again, you're contouring over the structure. But what you're doing here is you're just slowly engaging the tissue. So whether it's what we call ischemic compression, right? So we're actually compressing down into the tissue gently, and then we hold, right? So that compression is not to where I'm pushing down very quickly. It's a very slow compression into the tissue. We hold, and maybe if we're lucky, we get a little bit of a melt to the tissue. And then we slowly release. We want, if you think about it as you're pushing on the tips of your fingers, you watch the blood flow away. And then as you lighten up your tension, you slowly allow that blood to flow back into the area. And I like to think of it as like gently squeezing a sponge. You're pushing everything out and then you're soaking that nutrients back up into that tissue and allowing it to relax. And that's compression. And there's various techniques of compression in addition to that, but that's most general compression.
But
And
what
an easy one and safe one for pet parents to do, except for over the joint area, not directly over nobody wants to be pushed over the bony
don't
prominences.
push
That's
the
uncomfortable. We're
elbow.
not doing on the elbow. We're not doing directly over bony prominences. So there are some contraindications to the areas that you want to stay away from. But for the most part, compression is a very safe technique to add in at home.
I'm going to add a little bit of clarification. You said ischemia, but let's go through that. So
Oh,
ischemia
yes.
is when you compress and the blood actually leaves that area through the
Area.
blood vessels. And then one of the ways that it works to relieve that trigger point is when it comes back, it stimulates the Golgi tendon organ, which says
Yes.
to the brain, hey, release this. And that's
Yeah.
how you work with the trigger points. And if it's okay with you, what I'm going to do real quick is if you guys listening want to, you can put your hand on your shoulder and find a trigger point on your shoulder. And then very gently, I like to do this with breathing. So we're going to do a big inhale as you put a little bit of pressure in. And then a big exhale, push up more, deeper pressure. We're going to do that one more time. A little more pressure as you breathe out. And as you do that, you should feel that trigger point is gone or at least significantly better. And I love the fact that when we breathe, we can not only affect our nervous system because doing that big exhalation stimulates the vagus nerve and releases acetylcholine and serotonin into the brain to say, hey, rest and digest.
We're okay.
We're okay. And now you guys know that the amount of pressure you put on your own trigger point is like the most amount of pressure you would ever put on a dog or
Yeah.
cat.
Absolutely.
Sorry, I had to
Absolutely.
nerd out for a second.
Yeah, I love it. I love it.
All right,
Okay,
let's do
so
one more. Hold on, we got
okay,
Effleurage.
all right.
Let's go through Effleurage and then we'll take questions from everyone watching.
Perfect.
Effleurage. Okay, so effleurage is a long, even, comfortable stroke that you can start from the head to the tail. You can go down the limbs in a long, rhythmic stroke. I am a big believer in when you start doing body work that when you put your hands on the body and you are facing the animal, right? Their back is generally towards you if they're laying down, or if they're sitting, their head is facing away from you, and you're making this connection. And I make the connection as like, I think about it as this circle, right? So once I'm there, I keep my hands on the body. And so I might start from the top and work down the hole and stroke. And one hand is always on the body while the other one may start the stroke. Or we start here and then we slowly shift up. But what I'm not doing is bouncing off the body. If any of you have ever had a massage and all of a sudden your massage therapist walks away, it's very jolting, right? So once you start that effleurage, you're actually taking the long strokes down the whole length of the body with intent. It feels much different than petting. Petting is more at a superficial and fur level, where the effleurage is deeper. It's actually into that superficial tissue. So you have a very slight drag of the tissue that comes with your hand. You get like this nice little ripple in front of your fingers as you're gliding down. And it's very rhythmic. And it's a wonderful way to calm your pet. It's a wonderful way to start or end the body work session. For those of you that are doing body work, but for pet parents, it's like the most beautiful way to just kind of go, okay, I'm just going to do a little work, because it works in so many different ways. It's relieving that superficial fascia, and it's like getting things moved up. It's hitting those lymphatic vessels. It's calming the nervous system. It's getting all the different areas that we want. And it really just sets them at ease. And it's such a nice technique to do, and it's not hard. So it's basically like if you were to take your hand and you're just gently stroking, adding a little bit more, like you're getting a drag, like you're not going directly over the skin. You're getting a nice glide over the tissue and then starting again. But make sure if you're doing this with your pets that one hand is always connected to the other. And
Yeah.
that's the whole thing about it, is just making sure that when you are making that connection, you continue that connection. And so effleurage is a fantastic, and it's pretty much used for all the time when you're doing body work. It's very well known and a beautiful technique.
Absolutely. I love to just, you say, don't take two hands off. My way to explain that to people is to say, it's like if you're taking your hands off, even if you're like, I'm going to go get a pen and write this
Yeah,
down, right? It's like somebody,
right.
mom, 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 mom,
Yes.
right? Right? The
Yes.
animals are like,
Yes.
what are you doing?
Right. Yeah, it is. I know it's very jolting, right? It's very jolting to have that interruption in that moment,
Yep.
especially when our nervous system is going from here and then we're having a slow decline and we're just about ready to relax. And then they're like, but wait, and it's like, where'd you go?
Right,
And the
right.
dogs will know that. And that's the thing, is that when you're working with these techniques, as soon as you are interrupted, or even if your brain is like, I'm making a shopping list while I'm doing this work, the dogs know. They're
Oh, yeah.
so brilliant. And so they have this, you know, ability to go, oh, you're not paying attention, and I can
Right.
tell. And they will get up and they're like, well, if you're not paying attention, I'm not hanging out here. And so
Right.
they get up and they walk away.
Well, and I think anybody who's had multiple massages in their life can tell the difference when the massage therapist that's working on them is like
Yes,
totally in tuned and, to me, I would say energetically connected,
a
right? With the
hundred percent.
intention
Yeah.
of bringing out the best effect possible versus somebody who's just half there doing a job, because that really
Hmm.
sucks. Then you're like,
Yeah.
okay, when is this going to be over and why am I paying for this?
Right. Right. Yeah.
Right.
Very much so.
All right, Christine, you've got questions.
Yes.
We do.
Hmm.
We have some questions. And the first
Hmm.
one is, does Kasey have a specific canine population that she loves working with most? Seniors, athletes, etc.
Oh, I love the oldies. I do. I have a special place for the older dogs. I think that for several reasons. I think that it's so cool to be able to be part of that part of their life, and I think That's where I love to teach the pet parents what to do, and help them kind of show them some techniques that they can provide for their pets to just make them feel good, because this is their part of their stage of life where they're slowing down, and
Mhm.
a pet parent's getting very worried about what's going on, and there's a lot of pain involved because there's arthritic changes or other changes that are happening, and this is that moment where you can intervene and go, hey, wait, well, there's always something that we can do, right? And so let me show you some techniques that will be so soothing. And then they report back, and it's like this, well, man, he hasn't gotten on the couch for months. And all of a sudden he just jumped up and sat next to me. We watched TV last night. And it's like this yes moment. And I love that so much, of just being able to give them that information so they can do that for their pet every night. But also just the change that you see. They have gone through, whatever their job was their whole life, um, and these pets are tired and they're achy, and they're coming in, and there's like, they just put them on pain meds and this is where it's going to be. And I'm like, no, that doesn't
Right.
have to be that way. So I would say my oldies are definitely my favorite. Yeah.
Okay, next question is, can there be any wrong ways doing massage?
Oh, of course, there's always something that you can do wrong.
Don't put
Yeah,
pressure on
like
people on
using
top
your
of us.
elbows. I think probably the biggest thing that we forget is in human massage, we are like, get in there and just get it. And we want people the massage therapist to really hit those trigger points really hard. And but the difference is that we can tell that person, the massage therapist, hey, that hurts, that's too much. This
Mhm.
is the amount of pressure that I like, this is the amount of pressure that I don't like. And the animals can, if you're listening, they can tell that too. But if you're not, if you're not regularly seeing those cues from your pet, and you're using a lot of pressure, you absolutely can hurt them. And the other thing is that if the fascia has been locked down for a very long time, and you go in and you start loosening, it raises the lymphatic. This is the blend of the lymphatic system as well, is that lymphatic system and all that metabolic waste that's been sitting in there for a long period of time all of a sudden goes whoosh, I have space to run. And it can cause them to be very sore. And so then you get a phone call, or your pet parent has been doing work and they're like, this massage made my dog really, really sore. Well, that's because it was too much. And so there's definitely a delicate, there's intricacy to the body work that we do, and that the pet parent can do. So yeah, you absolutely can do some damage if you're going in too deep or you're doing too much, right? And so there's a timing of like a young healthy dog at 2 or 3 years old that has like, is really doing well versus a geriatric dog. They cannot handle the same amount or the same pressures or even the techniques all the time. So absolutely, there are things that you can do that you should not, that could cause some damage or harm or pain.
I'm going to throw some information in there too. I have my what to look fors. So
Mhm.
yawning, sighing, burping, passing gas, and licking their lips are signs that you're doing a good job.
Yes.
If they're like the eyes wide open or they're panting and
Mhm.
they stop, if they give you that, to me, it's the Rottweiler sideways glance that
Mhm.
feel
A little
that.
side eye. Mhm.
Yep, yep. And then
Yep.
the Labrador Retriever, which is, I'm gonna put my head on your hand. Please don't do that.
Yes.
Or
Or
the,
my paw.
yep,
Just please
yep.
stop. Please
Or
stop.
the, or the Border Collie. I'm gonna lick your face to change the subject, right?
100%.
And
Yes.
then the most would be obviously, I'm gonna get up and leave.
Mhm. Mhm.
Um,
Yep.
and then the
Yeah.
other thing
So,
I wanted to say was with your geriatric patients is realize just as they get older, they have less blood volume. So they have less, and they have less muscle just from getting older. So you
and
need,
less hydration in
right,
their
less
tissue.
hydration. Yep. So you
Yes.
need to go softer and
Yeah.
gentler.
But that's it for questions tonight, unless anybody else has one. Oh, hold on. Sarah May says, thank you, Kasey and Dr. Lori.
Thank you,
Oh,
Sarah.
thank you, Sarah. Awesome. All right. Well, I hope you had fun, Kasey. Hope you'll come back.
Yes, thank you so much for having me. I appreciate that. And it was wonderful. It was really fun.
Yes, and a lot of fun. And
I hope
hopefully,
you all learned a little bit of something cool.
yes. Yep, absolutely. All
Yep.
right. We'll see you again sometime soon.